Hello and good afternoon. I'm Casey Seiler, Editor-in-Chief of the Times-Union, welcoming you to the 2022 Salute to Nurses, our 8th annual celebration of some of the finest medical professionals in the greater capital region. While this event predated the COVID-19 pandemic by a very long stretch, it's fair to say that the events of the past 2 years have made everyone at the Times-Union even more proud to be associated with it. From my own perch in this pandemic-emptied newsroom behind me, I've seen journalists rise to the times with hard work, meticulous craft, and in some cases, actual physical bravery as we've tried to tell the stories of COVID-19, because we recognize that it's one of the stories that will define our careers as journalists. But that awareness goes double, triple, even quadruple for healthcare professionals who have quite literally put themselves on the line to protect, to heal, to comfort, and in too many cases, to grieve along with the families of the lost. This is, of course, nothing new for those in the medical field, but the difficulties and dislocations brought on by the pandemic, from safety protocols to short staffing and more, make this year's Salute to Nurses one of the most meaningful to date. Before we begin, I'd like to thank our presenting sponsor, St. Peter's Health Partners, as well as our supporting sponsors, Albany Medical Center, Maria College, and Columbia Memorial Hospital. And now we have a special message from Dr. Steve Hanks, the Chief Clinical Officer from St. Peter's Health Partners.
Hello, I'm Dr. Stephen Hanks, Chief Clinical and Chief Operating Officer for St. Peter's Health Partners. It is my privilege to recognize the remarkable Capital Region nurses being honored this year as part of the Times-Union Salute to Nurses. It's no secret that nurses provide healing, comfort, and a gentle touch in the most dire of circumstances. But nurses also provide inspiration, and not just to their patients, but to the colleagues they work alongside every day as well. I have witnessed this inspiration in action throughout my medical career, but most especially in recent months. During the past year, I've rounded in our emergency department and have seen firsthand the many talents of our nurses. One story I would like to share happened recently during an overnight shift in the ED. It was midnight and we were absolutely swamped. There were more than 30 people still waiting to be seen. Seeing the stress this was causing our patients and staff, the overnight nurse manager took it upon herself to figure out a solution on the spot. She created new hallway treatment spaces and was able to move all the patients from the waiting room to gurneys, chairs, or whatever was available. While not ideal, it was crucial to helping these sick patients. The move created visibility and in turn it added urgency for providers. Staff who ordinarily would have been preparing to leave at the end of their shift volunteered to stay. I was one of those who stayed. Instead of working from 3 to midnight, I still stayed until 6:30 the next morning, as did the doctor who was supposed to leave at 2 a.m. This nurse manager, like all the nurses throughout our organization, was a hero. Like a general on a battlefield, she marshaled our forces and inspired them to greater heights. Her actions brought to mind those of Florence Nightingale, whom National Nurses Week honors. Florence's actions during the Crimean War as a nursing manager on the front lines inspire all of us in medicine, providing invaluable lessons that have revolutionized healthcare. I hope you recognize this strength in yourselves and never let go of it, even in difficult times. You all make a difference in the lives of your patients, their families, your colleagues, and in your communities. Without you, we simply cannot function. Thank you for all you have done and continue to do in every moment to improve the lives of others and inspire all whose paths you cross.
Thank you for that message, Steve. Next on the agenda, we have Chris Jordan, the Chief Nursing Officer at St. Peter's. Chris, the floor is yours.
Hello, I'm Chris Jordan, and I have the privilege to serve as the Chief Nursing Officer for St. Peter's Health Partners Acute Care Division. In this role, I have the opportunity each and every day to witness firsthand the very best of nursing. Not only the incredible care the nurses of St. Peter's Health Partners in the Capital Region provide, but more importantly, how that incredible care heals our entire community. The nurses of the Capital Region have continued this legacy of caring, despite some of the most challenging times in many of our careers. The ongoing pandemic has, in many ways, challenged our resolve and our purpose. It has challenged the deeply personal call to nursing for so many in the region and across the nation. I could not be more honored to be here today, addressing the incredible nurses from across our many communities. I am always amazed by the stories told through the nominations. Stories of caring and compassion, stories of life-changing connections that transcend the provider-patient relationship. These stories ground us in our why and our purpose for nursing and inspire us to be better nurses. Congratulations to all of those who are nominated for this year's Nurse of the Year Award. You embody the concept of nursing excellence in the work that you do every day, and for that we thank you. The American Nurses Association has themed this year Nurses Month, You Make a Difference, and has challenged each of us to reflect, recognize, and rejuvenate. In doing so, the ANA is providing us a framework for recognition of nursing excellence, but is also acknowledging the need for a systemic approach to nursing wellness. First, what does it mean when we are called on to reflect? Reflection can be a very personal exercise in which we pause and reconnect to our purpose, to recognize our opportunities, and to consciously choose our path forward. Very early on in my career, I experienced the impact nursing can have on the lives of others. As a home health aide during college, I was driven by the impact that a single person can have on the lives of those we serve. This one summer experience has served as my North Star throughout my career. As we focus on this idea of reflection, it's important that we take a moment to stop, clear our minds, and remember our why. Remember and reflect upon what called you into the field of nursing. Remember the transformational experiences you have had with your patients, and remember the impact you have made on their lives and the impact they have made on yours. The American Nurses Association's second action is that of recognition, or the need for nurses to recognize one another. This annual event embodies the importance of recognition for this critical profession. I want to take a moment to recognize the Times Union for their commitment to nursing in the Capital Region and their willingness to host this event year in and year out. Beyond formal recognition events such as today's celebration, we must also leverage our collective voice to recognize the importance of nursing, to raise the visibility of the critical work we do, and highlight the incredible diversity of all roles and people within the profession. It has never been more important for the voice of the nurse to be heard, and for those who have the greatest impact on our patients to be involved in the decision-making. Today's healthcare environment has changed. It has never been more challenging to work at the bedside than it is today. Nursing, more so than any other profession, understands the impact of this changing healthcare environment and the challenges that our current workforce faces daily. A dramatic increase in violence against nurses and other healthcare workers can no longer be brushed off as a part of our job. Violence is a significant driver of nurses leaving the profession. This is a matter that requires attention, resources, and action from local, state, and federal government. Lastly, the ANA calls us to focus on rejuvenation of ourselves and our current workforce. As noted, the stressors of the last several years have been many. Between the ongoing pandemic and increase in violence against those serving at the bedside, the mental health needs of today's healthcare workers have never been greater. Rates of burnout and compassion fatigue of those who have served at the bedside are skyrocketing. Self-care is an important part of rejuvenation. Modalities like meditation and frank conversations with other healthcare providers can offer some relief, but there needs to be more. To truly support the rejuvenation of our nursing workforce, it is imperative that our behavioral health infrastructure as a region be positioned to support not just those who present for treatment, but those who serve them. We must be prepared to respond to our bedside colleagues' emotional needs and support them through the most challenging of times. Only then will we begin to see a rejuvenation in today's workforce. Each of the incredible stories told through this year's nomination reinforce what I continue to feel every day. I am proud and honored to call myself a nurse and serve alongside each and every one of you. Congratulations to all of those recognized in this year's Salute to Nurses.
Thank you, Chris. With that, let's meet the 10 nurses who have been selected for recognition this year, each of them nominated by their coworkers. Our first is Deb Butner of New York Oncology Hematology. Butner became an oncology nurse at an age when many others might be planning retirement. Despite the challenge of getting trained in a host of new procedures and practices, she is described by Regina Resta, who nominated Butner for this recognition, as, quote, one of the best oncology nurses I've worked with in my 25 years as a medical oncologist. I saw her compassion daily in the chemotherapy treatment room and when she took calls from patients. Deb never loses her caring manner, even when the calls from patients and family members seem endless during these challenging times. She has inspired me as a physician to remain caring at seemingly hopeless times. Our next honoree is Anne-Marie Calabrese, who works in vocational rehabilitation in the State Office of Victim Services. Since 2016, Calabrese has worked with crime victims, their families, healthcare providers, contractors, therapists, and others to ensure victims of crime receive the best services and care possible and are getting reimbursement for necessary care regardless of insurance coverage. Katie Egglfield said Calabrese's positive attitude, tenacity, and compassion are qualities one would hope for in any nurse, but her tireless personal mission to improve the lives of victims of crime make her Nurse of the Year. Also recognized this year is Colleen Crosby, a clinical nurse manager with the Northern GI Endoscopy Center. A former administrative supervisor at Glens Falls Hospital, she has worked tirelessly to improve patient care while strengthening her bond with fellow nurses. Colleen's success, according to her longtime colleague William Bauer, is clearly derived from years of dedication to striving for excellence. Our next recipient is Rachel Denty, a pediatric ICU nurse educator at Albany Medical Center, who was nominated by 5 members of the pediatric ICU staff. Dente worked her way from patient care associate to registered nurse to clinical nurse educator in her 12 years at Albany Med, where her enthusiasm, positivity, encyclopedic knowledge, approachable manner, and patient care, quote, embodies the spirit of nursing, always encouraging colleagues to work harder, achieve goals, and step outside of our comfort zones. Next on our list is Mary Geisel, a registered nurse specializing in emergency care at Albany Medical Center. Though she retired several years ago, Geisel has continued in a part-time capacity in the main tertiary care center for all of Northeastern New York. As a nurse and on the first responder level, Mary has experienced all of the terrible consequences, helping patients infected with COVID, comforting many who did not survive. Mary fully met this towering responsibility with intelligence, foresight, care, professionalism, and compassion, said her colleague, Sorel Brouth. Our next honoree is Kelly Jo Jarosz, the clinical coordinator of the A3 Medical Surgical Unit at Saratoga Hospital. Through the pandemic, Jarosz led her team with compassion, courage, and operational expertise beyond the scope of anyone's wildest imagination, Deborah Fields wrote in her nomination. She is a strong advocate for her staff, always concerned about their patient acuity and workload throughout the overload and stress of COVID-19. It's a story we should note that Jarosz shared with the Spa City community in the second year of the pandemic. Kelly Jo personalized a glimpse in the day of a clinical bedside nurse, Fields wrote. She received a standing ovation from her audience. Our salute continues with Shatana McCrae, a lead clinical nurse at St. Peter's Diabetes and Endocrine Care. 4 of her colleagues wrote that, quote, Shay single-handedly keeps our practice running. She trains and supervises clinical staff and filled multiple roles to keep us running through COVID-19 staffing issues, serving as interim office manager, running our lab, and ordering our supplies. Shay helps everyone, even if it's not part of her job, they wrote. Lisa McDonald, a cardiac clinical manager and registered nurse at St. Peter's Health Partners Albany Associates in Cardiology, is our next honoree. McDonald was nominated by 8 of her colleagues who said her, quote, compassion, leadership, and calm personify her presence as a nurse and manager, responsible for making sure that patients are cared for, jumping in to cover pandemic staffing gaps, and keeping the team strong. She goes above and beyond to help patients. She is reliable and takes pride in treating people. Belinda Spinner, a surgical registered nurse at Glens Falls Hospital, has for years been known for her ability to forge therapeutic relationships with her patients. She can be found sitting next to them and getting to know them as human beings. Belinda is a caregiver for our patients and a caregiver for the caregivers, helping families and nurses alike come to closure and cope with loss, said coworker Stacy Schlack. Spinner also started the hospital's Darn Tough hiking group, leading hikes around the North Country for nurses, staff, and their families. Last, but certainly not least in our rundown, is Michelle Warner, school nurse and nurse coordinator at Ichabod Crane High School, who, quote, worked countless hours over the last 2 years dealing with the COVID-19 pandemic and its ever-changing impact on the functioning of school working days, nights, and weekends. I do not know what we would have done during these trying times without her. Her colleagues noted the pressure placed on school nurses by anxious and even angry parents. In many cases, Michelle has felt the brunt of reactions, emotions, feelings, fears, and panic stress. While experiencing all of this, Michelle has maintained the utmost professionalism and a positive attitude. Congratulations to all of our honorees. We'd also like to recognize 15 finalists whose good work was praised by their coworkers as well. They include Lori Brand of the Eddy Visiting Nurse and Rehabilitation Center, Lisa Catalano of the Hildegard Medicus Cancer Center at St. Mary's, Chrissy Curcio of Ellis Medicine, Rebecca Denoffer of Saratoga Hospital Center for Breast Care, Nancy DeSando of the ARC, Lexington, Clifford Esteris of Albany Medical Center, Amanda Greco of Marquis Certified Home Care, Nancy Jones of Mid-Hudson Regional Hospital, Glenda Kelman of Russell Sage College, Kimberly McNamee of the Massry Residence of Daughters of Sarah, Raimondo Mingua of Columbia Memorial Health, Talia Palazzi of St. Peter's Internal and Family Medicine, Devin Sedgwick of St. Peter's Hospital, Sharon Thomas of St. Peter's Cancer Care Center, and Donna Thompson of Community Care Endocrinology.
First question was, what made me go into nursing? And I've been a nurse for several decades now, but originally I always loved biology. I still do. I love the science of it, the human body, the systems, the structure and the function. So that was easy to study and learn. And I like the opportunity that nursing offers to be able to participate or be a part of people's lives at a time when they need care. Nursing makes you realize that we're all vulnerable to the same diseases and accidents. And I always tell my patients that today I'm in the role of the nurse, but tomorrow I could be in the role of the patient or one of my family members on the other side of the bed.
Well, when I was a little girl, my mom had volunteered. Well, I guess she worked as an aide in a hospital, and she used to let me play with her uniform. And all I wanted to do was to wear that nursing cap. Whenever I think about back in my life, I always wanted to be a nurse, always. And the other thing I really wanted, beyond anything, any kind of money I got, I was like, I'm gonna get nursing shoes, and they were called nursemaids, and they had a little heart on the heel, and that's all I wanted. And so I got them and arrived at Glens Falls Hospital with my nursing uniform on, and learned that that is like the least of what happens with nursing, but it did get me in the door.
I didn't have a very definitive reason why I became a nurse. I simply love people, and I guess always wanted to be part of the good in this world. The better answer I have is why I've stayed a nurse for 39 years. I still, every single day, I put my scrubs on to come to work. It makes me very, very happy. I never have a day that I say I don't want to punch in. And I guess I know that I make a difference with every day that I work.
Ever since I was little, I always wanted to be a nurse. I know probably everybody says to help people, but when I was young, I took care of my grandmother, and I took care of another elderly couple, and I decided that was the profession I wanted to be when I got older, as a nurse. And I have been in high school. I went to nursing school, to LPN school. So I started young.
Growing up, I had an aunt who was a nurse. She was a labor and delivery nurse out on the West Coast. And she's wonderful. She is kind and she's caring. She was soft and gentle and very nurturing whenever I was around her. And I was always like, oh, I want to be like that. You know, if that's what a nurse is, that's what I want to be like. So I made it happen.
When I was in the 7th grade, my mother and I were talking about what I wanted to be when I grew up. And my mom said that I would make a good nurse because I liked people and I liked helping and I was good at science. When I got my first CNA job at a small nursing home, I knew that this was going to be the job that I wanted to do for the rest of my life. And 37 years later, I have never regretted it.
So back in my early 20s, I was doing an internship at Shands Hospital in Gainesville, Florida for therapeutic recreation. And during that first week, I was watching a group of these men and women in similar uniforms, saving lives, performing and assisting in some of the most amazing medical procedures I had seen up to that point. Sitting with dying patients, taking care of not only the sick, but their families. So after that first week, I asked one of them, so what exactly is your title here? And she said, we're registered nurses. And it was that moment that I said, well, that's what I want to be. And that's where I belong.
I just remember as a child, I was very interested in how the body works. My mom would show me different things from her nursing textbooks, explaining things to me. I became more and more interested. And as I grew, I found that nursing seemed to be the right amount of science with the right amount of people, incorporating all skills like that. And it was extremely interesting to me. As a teenager, I did volunteer work at our local hospital, and it really solidified that this is where I wanted to be.
You know, like most nurses, I had that innate drive to help people. I was convinced I was going to be a social worker for the longest time. And then I took a high school medical technology class and really just fell in love with the science and the medicine. And what better way to combine those two things than nursing?
So it may sound cliche, but I actually became a nurse because of my mom. I was young, 16, I was a mom, and she basically said, you know, nursing is what your career is going to be. I wanted to do cosmetology, but she was not having it. So I started out as a certified nurse's assistant. I worked alongside my mom because she was a nurse at the time as well. And I loved every bit of it. Just watching her and watching the nursing staff, it changed my entire view of what I wanted to do for my career. She then got cancer, and just watching the nurses, you know, care for her from the moment she was diagnosed to her final days, you know, with us, they did nothing but love and care for her. And that's what I wanted to do. I wanted to make a difference in people's lives the way she did, because I felt like my mom, any room she walked into, any person she came across, she just left an impression that was unforgettable. And she definitely guided me to be where I am today.
The other question was like a favorite moment that you've experienced in your career or nursing. So I couldn't pick a single moment, but there are several moments that are very, well, that impact you very strongly. And last year, this is just an example, I had a patient that was getting chemotherapy over a long period of time. And last fall, his disease started to progress quite rapidly. Now, he had always talked about his children, and he was extremely proud of his son, who entered the Marines right after high school, and he finished his training during the course of his coming for therapy. And the patient had said how he was going to be home for Christmas. And I was out Christmas shopping in December, and I saw this little ornament. It was a hanging ornament. It was just a little Marine cap. And I immediately thought of this specific patient. So I bought it. And when he came into the clinic the next week, I said, "Oh, I have something for you." And it was just in a little gift bag with a, tissue paper. And when I gave it to him and he opened it, the look of gratitude that he gave me was just flooded me with emotion. And it makes you realize what blessings there are just in human to human interaction and in each moment. It was just a very precious time.
I couldn't pull one event out that was more important than anything else, good, bad, or indifferent. I wouldn't say I enjoyed every single adventure that I had in nursing. It's been challenging. There's been times when you're just flat out. It's just a lot. But all in all, you get up and do the same thing. And at the end of the day, I was content on how the day went. And if it didn't go well, let's do a better job tomorrow, and just carry on.
In 1998, I was way up near the Canadian border, and I was part of that horrible ice storm. I've had many special patients, many special opportunities to make that difference. But this particular opportunity, the police chief had asked me if I would come down and simply take care of one diabetic patient. And within 7 days, I had evolved into managing 7 different shelters, staffing all of the shelters, sometimes with some of my old patients, retired nurses, not old patients, I'm sorry, old teachers, retired nursing instructors. I worked with a local pharmacist under a Coleman lantern, filling scripts for patients that I identified were the priority scripts. I worked with the local prison to get food to all of these shelters, and also actually had a contact with Lincare in order to get oxygen to the shelters. So it was a big job that an associate degree nurse really had to pull up her big girl pants and decide whether I could manage it. And it was fast coming. It was fast moving too. After 7 days, I was ready to go back home, and all of the people were back to either acute care or into their homes.
I have a lot of memories, some good, some stressful, but probably one of the memories that sticks out the most is when I first got out of nursing school. And I was the first person at an accident scene, and I was able to help a young girl survive. So that's probably one of my favorite memories.
I did a call back on a patient sometime this past year. It was a gentleman who had had COVID. He had had a rough go of it, and we were talking, and it was a very nice conversation, and it got kind of quiet on the phone. And then all of a sudden he started to talk again, and I could hear his voice was cracking. And then he really became very emotional when he was talking about the care that he had received from the minute he walked into the hospital doors. He talked about the compassion that he felt from every single staff member that had gone in to see him, to take care of him. He really did, he said that this had been one of the most stressful events in his life, and he could not come up, but he did not think that there were enough words to truly express his full gratitude and thankfulness for getting him through this time.
One night when I was working in the cath lab, I had a critical patient come into the lab, and I thought, "Ooh, this is not going to be good." It was a difficult case, but he had a good outcome, and I would visit him on the floor throughout his discharge, throughout his hospital stay. And when he was discharged, it was a very emotional day. And he thanked me. And to the day, I still get a Christmas card. So when you're a nurse, you really can make a difference.
So I was in a unique situation for the first 4 years of becoming a school nurse. My two sons, who were a grade apart, attended here at the high school that I work at. I loved being here and they loved me being here with them. So the most memorable part, and it happened several times, is hearing one of my sons halfway down the hallway yell out, "I love you, Mom." And the other kids yelling back, "We love you too, Mrs. Warner." I will always treasure those years prior to COVID.
Over the years, I've had many, many good memories of working as a nurse, especially in the emergency department for many years. And the most fond memories I have are being part of the team that we put our minds together. Everyone contributed. We all gave some ideas, and we did what was best for the patient and found some really solid answers. And I found that to be very satisfying to be a part of that team that could put things together and make things better for patients.
I think that for me, it's a combination of memories. Working in the pediatric ICU, we have kids that come in, absolute dire emergencies and that we may, sometimes think may not make it through. And to watch them leave our unit with their families, those are the best memories I have, to really see them come through and onto the next phase of their lives is something that's really special.
My favorite memory on the job is when I started working for geriatrics. I cared for a male patient who I cared for him for quite some time, and his daughters would come and visit him every day of the week if they possibly could, and the weekends. And one of his daughters turned out to be a doctor. I did not know where she worked, but as he, progressed in his life, I found that she was a doctor with St. Peter's endocrinology. And she saw something in me that she wanted where she was running a practice, and offered me this job to be a nurse with St. Peter's endocrinology. 2 years in, I became the LPN clinical lead, and that was also initiated by that same doctor who, again, felt that my caring and my, attention to detail, just, my focus on making someone's life better, this position was a good fit for me, and I love it. I plan on moving on in this career and hopefully change more lives.
The next question was, how has your experience been over the past year? And I'd have to say that since COVID, a lot of policy changes were instituted to protect people. And people used to be able to have a person come in, a family member, a friend, and accompany them during their treatments. And the treatments can be 3 to 4 hours long. And of course, after COVID started, we didn't allow visitors in the rooms. And then we had to put plexiglass up between the chairs. And of course, everybody had to wear a mask. So there was a lot of isolation. And this is at a time when people are very anxious about their diagnosis. And most people do feel ambivalent about receiving chemotherapy. I mean, they're worried about if it's going to be effective, and also if it's going to cause them a lot of side effects. So it changed the role of the nurse. It evolved into more trying to, in a small way, replace that that visitor that was there with them for the whole time previously. And the you have to like make the moments of direct caregiving count.
Yeah, I was lucky. Yeah, lucky. I was able to come in to work every day, so I had the stability of a routine. All my supplies are here in the office. A phone that was easy to use, equipment that I could use, and I was able to really be able to carry on.
Since COVID has started, since the first day COVID hit our hospital, I was the first nurse out managing all of the people out in the parking lots. So COVID has it's really, I guess when I think about this last year, the one word I think about is resilience. Nurses have oftentimes held the hands of multiple patients as they have passed away. And these nurses still go in every single day. They take care of their patients with love, kindness, great skill, and never lose the personal connection to family and patient. And finally, I'm a big climber. I love the Adirondacks. So for me, seeing people manage their job, leave, and use what we have to offer to their benefit, getting out into the community, walking, enjoying each other, enjoying the area that we have. It really has been very uplifting. So I just think it's all simple resilience, nursing, family, communities, all of us just being able to support each other and hopefully make it through this very ugly virus.
It's been a stressful last couple years with COVID. We keep seeing the numbers go up again, so that adds to the stress. But I think everybody really has stepped up the teamwork, with everybody working so closely together and being very supportive of each other has really meant a lot. And a lot of the patients, when they come in, are very supportive of the nursing staff. And that's really helped us survive COVID and all the stress that it has brought.
This last year, another trying year, multiple waves of COVID, vaccination, divisiveness, staffing shortages. I tend to be an optimistic person. So I kind of, for me personally, it's about the relationships and the bonds that have been forged with my coworkers. They are invaluable. Every day I go to work and I see nothing less than 100% from everybody working. I am inspired by them, their dedication, their selflessness, and their resiliency to be there every day, just helping out.
Even though the year has been challenging with staffing, I'm very proud of what we're doing here and good things that we're doing here, and the staff that has worked along with me in these challenging times and has supported me and has given good care to our patients.
What was once a place of enjoyment and an open door policy was replaced with a closed door and a phone call asking permission to see me. This year was difficult, exhausting. It felt like we were on a roller coaster ride, most of it, just hanging on for dear life. And it really expanded our roles beyond normal expectations. I know that it's hard or it's difficult to find light through all of this darkness, but we're still here and our students were able to remain in school. We're returning to some sense of normalcy, and the relationships within our district are stronger. I also believe that the school nurses across the country have gained a new respect and appreciation from their administrators, teachers, parents, and students. As the medical professionals that we are, that feels rewarding. It's an honor to be a school nurse. It means you have been entrusted with caring for students and staff. And I think that we successfully did that through this pandemic.
The things that I have taken away from the last year are that we need to let yesterday go. We need to so be ever grateful for what we have and where we are. And we need to be positive people to ourselves, our families, and our coworkers. And we need to also continue to surround ourselves by positive people. And we need to know that we are trying to do the best at all times for our patients, and that does take a lot of energy.
I think that this is, the biggest year for us. We're redefining what our role is, our space in the community, and, how we see ourselves.
So last year was unlike no other, with COVID still on the rise and the loss of so many, essential workers due to either the virus, family circumstances, or, this vaccine mandate. Healthcare was definitely put to the test. I feel that with COVID having such an impact on them and myself, that we stand here as nurses. We took an oath to practice faithfully in our professional career, and with all the nurses that are still here, still fighting and still supporting, loved ones and people who they will just happen to meet that one day. This year, I feel like we've all grown, whether we know each other or not. We've all grown as a family with everything that's been going on. I plan on continuing in healthcare for as long as possible and making sure that I can, again, touch as many lives and help anyone grow in this profession.
Congratulations to all of this year's honorees, along with our sincere hope that the year ahead brings a further reduction in COVID's impact on our communities, as well as more opportunities for medical professionals and those in all other professions to gather in person for celebrations of respect and admiration. You don't need a journalist or even a state bureaucracy to tell you that the work you do is essential. You live that knowledge and that commitment every day. For everyone at the Times Union, thanks for watching, and please be well.